Today's video, I'm going to talk about why things don't work. When you start a health kick, you start a new supplement, you start a new diet, a lot of people will be like, I tried that, it didn't work for me. I'm going to discuss what I've seen works and discuss why certain methods and techniques that people try, whether they've tried on their own or talk to other practitioners, sometimes it helps to kind of get feedback on like why something failed the first time around. And it doesn't mean that the second time you try it, it won't work, or it just needs a tweak. So the most obvious is having a side effect or reaction to a supplement. Now, it's always something you have to pay attention to, because when you try something new, every person is different. So dosing is not just relevant to like someone's weight or their age. Like children and adults, they usually would take a separate or different formulation. Sometimes there's a supplement I usually use, and I won't say what it is because I don't want people to be like panicked and be like, oh, I'm never going to use that, or I'm going to be sensitive to it. But there is one supplement that when I use it with patients, maybe 40 to 50% of the time, I'll get a call after a couple of days and they'll be like, is it normal that I have diarrhea all the time now? And it's yes, initially. So sometimes it's just your body getting used to a supplement doing something. It's not a probiotic, if you were wondering. Sometimes the typical dosage is too much. Sometimes the therapeutic effective dosage, you can't jump to at the beginning. You kind of let your body adjust to it. So if someone gives me a call like that, I'll be like, stop it for a day and then cut the dose down like a quarter of what you were taking. And over the course of the next week, slowly increase it and see where your tummy is with it. Because it's an expected common effect, as opposed to someone calling me like, yeah, I tried the supplement and I'm in a full body rash. Could that happen? Theoretically, could happen with anything. Could happen with water. Sometimes people's immune systems and their gut health are compromised. So when you introduce something, you kind of have to go slower. Going slower means lower the dosage and less frequent, and almost like let their body get used to it. So that's one of the most common ways or reasons why something fails, is because someone will try something that they heard is good for a condition or a symptom, and they take too much, or the formulation or the combination with other things may not be appropriate for them. So you have to maneuver around it. It doesn't mean that it won't work. It just means that maybe you need to take some time for your body to get used to it, which is common and is normal, and it can be expected. If something is just not responding well, though, if you do reduce the dosage and it's getting worse or not getting better, it just might not be for them. Sometimes hard to say. Another scenario or technique or therapy that often people will do on their own and claim that it doesn't work is an elimination diet. So people hear that, like, gluten and dairy and this sort of thing, that if they cut it out of their diet, they'll be fine. They'll feel better. And sometimes people will be like, well, I tried it for 2 weeks and it didn't work. I'm like, 2 weeks is never enough time for an elimination diet. The other thing that they'll comment and say is, well, I cut dairy out for 2 weeks, but I kept gluten. And then I cut out gluten. I think I talked about this in the last video. That never works either, obviously, because if you have a sensitivity, you're having 1A, your number one sensitivity, but you're avoiding 1B and vice versa. So that doesn't work. So when it comes to food elimination, you're looking at a month, and usually like a shotgun approach across the board. All the major ones that seem, or you're suspicious that may be bothering you. So you got to do it the right way, or do a food sensitivity test. I'm a big proponent of that. Other things to consider. Now, I know supplements are expensive, but there's certain places that you don't buy your supplements. I won't name the stores, but if it's like a gas station, they probably don't have the best quality. If it's somewhere that's got a lot of bulk, a place that sells things in volume, they probably don't have the best quality either. So that's something to be mindful of. You want to get very high quality. High quality means like pharmaceutical grade. And I typically use what's called like professional grade. Another thing to keep in mind, and it's usually in relation to other practitioners, is blood work. So a lot of patients will be like, yeah, I got some blood work from my medical doctor. I'll be like, okay, great. Do you have a copy? Can I see it? And they'll be like, no, they said everything was fine. Is it? I'll be like, well, didn't you have like low iron? They're like, yeah, I think I did. I'm like, well, do you know what your number is now? They're like, well, they didn't say. They said it's fine. Yeah. Always get a copy of your blood work. Get a copy of everything, any results. It's not enough for someone to say, you did a test, it was fine. You should have someone go through each marker with you because you need to know, you need to learn. You have to understand what these, especially when they were abnormal in the past. Far too often, a test is a great opportunity to know where things are and to be proactive. If you do a test and your feedback is 0, then that test was a waste. Because it's not simply enough that everything was normal. What does normal mean? And what does it mean in relation to the last time you did that test? Because a lot of the times, and it's not just necessarily a physical, like it's a routine. Often someone will have a concern. They'll be like, I feel tired. And your doctor will be like, okay, let's do some blood work. And then the blood work comes back normal. You're still tired. Did it solve anything? No. Is it just because you're getting old? Probably not. In other words, get the results so that I can take a look at them and I'll tell you if they're good or not. Normal is normal. I get that. But it could lean towards high or low or deficient or excess or hyperactive or underactive. You would want to know because you can see trends and how things are moving in a certain direction. If you don't have those numbers and you simply just close your eyes and be like, it's fine, you're not going to learn anything. It's not going to be an opportunity to be proactive. I think that's what most people are looking for. I want to be proactive about my health. Or at least you should be looking to be proactive about your health. So you get a copy of your blood. Remember that. What are other things that don't seem to work, but doesn't mean that they're not going to work? Weight loss. Weight loss is a huge one. A lot of people, they'll say, I've tried every diet. I've done this one, I've done that one, I've done keto, I've done intermittent fasting. It works for a little bit and then it stops. So my question is, when it was working, was what was working a sustainable version of what was working? So it's not enough for something just to give an effect, because like you could just starve yourself for 2 weeks and lose 20 pounds. You lost weight. But what happens when you start eating again? It's probably all going to come back. So you always want to have a intervention that is sustainable. Because most people who want to lose weight, they want to keep the weight off, which is understandable. So if you're going to do a crash or extreme diet and then stop doing that extreme diet, of course you're going to gain the weight back. And that's when people get frustrated. Another thing that people do, and it kind of stemming from that last comment, a lot of people, they will turn on the health kick. They'll feel great. They'll eat right. They'll take their supplements. They'll exercise, proper sleep, good lifestyle. And then they'll cheat. They'll do something. They'll be like, I went to a party and there was gluten and I had some. I'm like, oh, okay. And they're kind of looking like they just got caught robbing a bank. I'm like, no problem. And then they're like, well, ever since then, I just said to heck with it, and I just started eating and doing whatever, and I'm not following anything you recommended. So that's weird because you were doing great, like beyond great. And then you're in a situation that like you cheated, you went off, your usual routine, which is okay, which is actually normal. I actually kind of build that into my programs because of this fact. Because some people are all or nothing, and they are good, and they'll keep on that track until something makes them slightly veer. But as soon as they do that, they lose all momentum, they fall off, they feel like they've sabotaged their results. They haven't. The only thing that has sabotaged the results is the fact that they've continued to cheat and have not gone back onto the routine. So that's why I encourage people in the beginning with diet and dietary changes, be prepared to cheat here and there. Maybe even once a week, a cheat meal. By doing so, you are reducing the likelihood that you're going to fall off the wagon and literally derail the train while you're falling off. Because for some reason, people think that they can't just cheat one day and then just go back tomorrow, back to your normal diet. No problem. For some reason, they get all like, that's it. It's over. It's not. I don't know why. I think it has to do with people being all or nothing. People are like, I have to be like totally perfect. No cheating whatsoever. It's not realistic because eventually the brain is going to say, just eat it, dummy. And then they do. And then they remember how much they like it. I have to sneeze. No sneeze. What else? Naturopathic pitfalls, things to avoid. Here's another one. Here's a good one. Sometimes people get really motivated, self-motivated, and they're like, I want to start this health kick. And they will go to the health food store and they will buy everything. They do a little research and they're like, I'm going to take this and this and this and this. And what ends up happening is that those grocery bags of supplements, you will get turned off swallowing pills super quickly. And 90% of those pills will just end up expired. Years later, walking into my office, and the person's like, I bought all these thinking I was going to help fix myself. And they've just been staring at me. And I'm like, I wasted a lot of money. I haven't improved anything. And they overwhelm themselves. And that's why I really try to limit a protocol for patients to 3 supplements, at a maximum 3 concurrently. That doesn't mean that they wouldn't benefit from other things. But I find that more than 3 bottles in front of them, it gets a little bit burdensome on the routine, a lot of pills to swallow, a lot of like scheduling, increased risk of like non-compliance, because the more things you have to remember to take, the more likely you're going to forget to take them. So with any good treatment or therapeutic intervention, there has to be an ability to comply. You must work compliance into the routine. That's why I try to schedule supplements in and around meals, that they will have an easier time knowing when to take them, an easier time like consuming these pills, so it doesn't feel like they're taking like a lineup of a train of pills and there's no room for food. Because obviously food should interfere with your meals. Food is your medicine. The supplements are meant to just fill a void and get you to a certain point where then food will continue that for you, assuming you're eating properly. So I'm happy when you go to the health food store. I'm not happy when you buy the store in the name of health, because you won't take all those pills, nor should you. And you should talk to someone who's an expert like me. What else? Here's a good one. This always makes me laugh. It's the worst when I actually have friends that are patients. They're not my friend. Two individuals, they're friends, and they both come to see me. Because oddly enough, more often than not, friends have friends with the same conditions as them. Don't ask me why. Let's just say two people come in and they both have fibromyalgia. Okay? Pretty common for a naturopath to treat fibromyalgia. I've treated fibromyalgia. The two friends, what they end up doing is that they compare notes. I don't know why they do that. One will come in, have a great conversation, give them a protocol. They start feeling good. They tell their other friend, hey, he helped me with my fibro. He can help you with yours. That person comes in, great conversation, different protocol. Everyone's different. A couple days later, one of the friends, usually the first friend, will send me an email saying, thanks for seeing so-and-so. However, you gave her something, but you didn't give that to me. Don't you think that would help me too? Well, if I did, I would have recommended it. Or I should just say, I liked her better. I want her to get better faster. Don't do that. Everyone's different. I do explain it nicely too. But when it's a video and hypothetical people, I can make fun of them. So that's a good one too. This used to happen a lot more. Not so much now. I used to make recommendations, and then the person would go like to a health food store and see if they had those, or if the person that worked at that health food store agreed with my recommendations, which would infuriate me at times because I just spent an hour and a half with you. You talk to someone beside the produce for 5 minutes, and now they're an expert in your health. And they change my prescription. And they say, no, you should take this instead. And they listen. The patient listens. Can't do anything about that. Sometimes it's hard. It's hard when you're having multiple practitioners or multiple experts giving you feedback, because I promise you, no two doctors are going to agree. They'll say opposing things, contradictory things. It's just how it is. Like medicine, especially natural medicine, it's not cookie cutter. There's no one textbook that'll be like, this is what you do here. This is what you do here. It can't. So everyone has a different spin, and that doesn't mean that it doesn't work. But the more people you ask, the more different opinions you're going to get. It's going to confuse you. So I do keep that in mind when someone does have other like experts, practitioners, specialists, what have you. I really, really, really try to be mindful of that. I'll be like, listen, I don't want to step on other people's toes. I don't want to be giving you conflicting information. I'm going to work on this avenue. Everyone else is working on these. I'm not touching that. I'm going to complementary help you in this way so that it doesn't feel like you're getting a million different perspectives and opinions, because that is confusing and people get overwhelmed, messed up, and then they stop doing everything. Or they just go back to whoever's the doctor's the most threatening. I'm not threatening. At least I don't think I am. So, yeah. These are just some of the things that I've seen that can make natural medicine complicated, or people kind of feel like it's an obstacle. And these are just good tips to remember to help kind of avoid failing before you start, because there's a lot of potential in what we do, but you kind of have to have a good perspective on it. So I hope this helped.